It's one of the most dangerous conditions that we operate on in brain surgery. It's an AVM, which is an abnormal tangle of blood vessels within the brain that can rupture without any warning, and it's a potential death sentence. Now, the only cure is complete resection, but the problem is that surgery itself can sometimes be just as dangerous as the disease. Now, the risk to reward ratio is actually different for each person. Now, how do we decide as neurosurgeons whether or not that risk is worth it for that person? Now, basically, for decades, we relied on the Spetzler Martin scale, which is a grading system that allows us to assess the risk associated with the resection of an AVM if surgery was even possible. And it basically looked at three things. Number one, how big is the AVM? Number two, is it in a sensitive part of the brain? And number three, does it drain into a deep venous structure? So we took those three factors and then it gave us a score from 1 to 5, and that told us whether or not resection is realistic or if it's reckless. But it ignored the patient. So Dr. Lawton and Dr. Young created a supplement to that scale, which pretty much changed everything. They added age, rupture history, and whether the nidus is compact or diffuse. So younger brains recovered better. Ruptured AVMs were actually considered to be safer for resection, and diffuse AVMs are far riskier. Now combine both of those scores and then you get a score out of 10 that actually better predicts the outcome for that patient. So a lower score means that surgery is on the table, but a higher score, then we would lean more towards radiosurgery or conservative management. And this is how we predict as neurosurgeons if an AVM can be cured in the OR or if the risk is just too big.